Recently, I'd say in the last 5 to 10 years now, we're having this kind of renaissance in psychiatry in this area of psychedelic psychotherapy and rediscovering the use of psychedelics to treat different psychiatric illness. And I think it's really a big breakthrough. And I've seen it profoundly just anecdotally in patients, but also in the research. And now, for example, Mount Sinai is starting a center to do experiments with psychedelics, and there's MDMA for PTSD.
That is very interesting. Yeah. It's going to be very, very fascinating to many, many people. So can you give us a little summary of the new discoveries in the use of psychedelics?
So there are a number. One is the use of MDMA, or what would be like the street drug of ecstasy, or now they have Molly with a more pure format. But that for the treatment of PTSD, there is, and I could talk about each one in detail, but just generally speaking, there is psilocybin, which is the ingredient in mushrooms, psychedelic mushrooms, to treat anxiety and people with end-of-life issues, who have, let's say, terminal cancer and have severe anxiety about death. And then there is ketamine, which is not quite a psychedelic. It's a dissociative anesthetic, and that for the treatment of severe depression and particular suicidality. And it just has a immediate, profound effect. Now it's just been FDA approved, the ketamine, as an intranasal spray called escitalopram, which is now being used as a treatment for depression, but they have intravenous. People go in for like a intravenous ketamine treatment for depression. So those are the major ones right now. But you can do one session with a psychotherapist, let's say, of MDMA, or 1 to 3 sessions, and it can really have a long-lasting effect. And now, the more recently, people are looking at DMT, or the ingredient in ayahuasca, as a treatment as well for certain psychiatric illnesses. And there are new studies now looking at,
So this is kind of a revelation to the patient who's been suffering from this condition maybe for a long time, and there's a lot of pain and negative effects on other people also. And suddenly you drop acid, in the old 60s slang,
right.
or you take MDMA and you take it in microdoses. Is that correct, or what?
No, actually, it's not in microdoses. It's actually, you take a kind of a dose that would give you an effect. We find that actually the microdose, so some people like at Silicon Valley and whatnot, or it's this trendy thing to do microdosing, especially out there on the West Coast. But that people say they're
we
more...
know what they're like.
Those West Coast hippies. No.
Yeah.